Thank you so much, Rex. Hey, Pine Belt, joining me now is Dr. Sarah Queck. She's an ophthalmologist with Hattiesburg Eye Clinic, and she's going to talk to us today about women's eye health and also Safety Month. Why was it important to make sure we designated April for women's eye health?
Yeah, so actually women are more susceptible than men to a lot of different eye problems. And those are things like glaucoma, cataracts, macular degeneration, dry eye disease. So I think it's really important to really focus on women's eye health.
And so what makes us more susceptible to that? Does it come with age, or does it come with different factors?
Yeah, you know, age is a big factor. Women on average live longer than men. We have longer life expectancy. So a lot of these eye problems are age related, especially glaucoma, macular degeneration, cataracts. The longer you live, the more likely you are to have them. So age is definitely a factor. There's other things like hormonal changes. Women go through a lot of different changes, and that contributes to different eye problems. And then women are more likely to have autoimmune diseases, thyroid eye problems. So all those factors contribute.
And when you talk about hormones, you could be talking about hormonal changes when you're a teenager, and also a big hormonal change when you're pregnant.
Exactly. So during puberty, you know, teenagers have a surge of hormones and they have growth spurts. Their eyes grow as well. So they could have a big change in the prescription in their glasses, or maybe they've never had glasses and then they need them. And then pregnancy, of course, you have a lot of estrogen, progesterone changes, and so that can change the cornea, and it can actually make you more nearsighted. So women might notice that their vision gets blurry. We might have to temporarily change their prescription during their pregnancy. Usually that will go back to normal, you know, once they have the baby, they're postpartum, but not always. And then menopause, of course, is a really big change. So you get a big decrease in hormones. And the biggest thing we see is dry eye disease.
And so how can we make sure that to prevent these things, or if we can't prevent them, how do we make sure we keep our eyes as healthy as possible? You
know, really the biggest thing is just prevention. So I think everyone over the age of 40 needs a comprehensive eye exam. So a full eye exam where you're dilated and your eye doctor checks everything. A lot of these eye problems are asymptomatic early on. So you might not have any problems, but you come in and your eye doctor might notice some early changes consistent with glaucoma, early cataracts, macular degeneration, and then dry eye. We have a lot of treatment options. So that's the biggest thing, is just a yearly eye exam.
And so last thing, what can you tell people, kind of like this last thought about women's eye health, to make sure that we stay healthy? Any habits food-wise?
Yeah, you know, just overall healthy lifestyle is important. You want to diet lots of leafy green vegetables, fruits. That's been shown to help with eye health. Then you definitely want to control diabetes, high blood pressure, cholesterol, avoid smoking, always wear eye protection in the sun, and in high-risk activities like mowing the lawn, you know, anything around the house where you're hammering, you want to wear eye protection. So that's really important.
All right, Dr. Sarah Queck with Hattiesburg Eye Clinic, thank you so much for being with us. Pine Belt, don't go anywhere. We'll be back.